Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, two Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment.
Welcome back to Breast Intentions. Today we're tackling a topic that touches every smile, dental health and its powerful connection to overall well-being, especially during key stages of a woman's life. I'm thrilled to welcome Dr. Talia, a leader in dental care with nearly a decade of experience. As the head of My Island Dentist right here in the Cayman Islands, she's dedicated to patient-centered preventative dentistry with a special focus on women's health. As a mom of two, Talia brings both expertise and real-life understanding to the table. Today in the studio, we have Dr. Talia. Dr. Talia is a dentist from Canada, so nice little group of Canadian girls here. And I just want to welcome you to the show, and thank you for agreeing to come on, because I know that there's a lot that we can talk about with regards to women, women's hygiene, women's teeth, going through menopause, going through midlife. So maybe just give us a bit of information on your background and how you ended up in the Cayman Islands.
For sure. Thank you so much for having me. I'm excited to be here today. My name, as she said, is Dr. Talia Davidson. I grew up in Northern Ontario, Canada, and I've been practicing as a dentist in private practice for 10 years this June. I'm excited for that milestone. I'm like, wow, I'm getting old. I graduated from Western in 2015 in London, Ontario, and then practiced in Toronto in the GTA for about 4 years. And then my husband and I decided to move to Cayman, and which I'm so excited that we did. Like, it was the best decision that we've made for ourselves and our family. And now we are here, and I took over a practice here in 2019. And now we're making our life here, and I'm learning more about dentistry here. And, every year it just gets better, I find, with this career.
Yeah. Oh, and you took over in 2019.
Yeah, about right 2 months before COVID. Oh. So that was stressful. But,
I bet.
Yeah. But everything happens for a reason, and now we're just going in a stride now with my team. And every year, like I said, we just find ways to bring our services to a better level for the community.
Your team has grown quite a bit as well.
Yeah, it has. We're very squished in that space. We do have plans to build a new office, which will take some time. But for now, I think we're getting into a good groove of, using the space to the maximum we can, just to help, get more patients in. But yeah, the team has grown, and we find every year we find someone new that wants to join us, and we're, always looking for good team members. Right. And it allows me to kind of step back and work with the team and work on the business as well, instead of always just practicing dentistry all the time, which can get very tiring, actually.
Yeah. Especially with two kids.
Yeah, exactly.
How old are they again?
My oldest, Madeline, is almost 3. She'll be 3 in May. And then our youngest, Kira, will be 1 year old in June. Okay. So she's about 9 months now.
Oh, wow.
Yeah.
Oh, you're busy.
I know.
So aside from, I know that you work with children. I know that you work with everyone, all the family, but I know that you also have a stronger focus in women, and whether it's women of all ages or women in midlife or going through menopause. What was the reason for why you focused on that?
I think it was because most of my patients were in that age group were bringing up topics that, I started to see every day, and it was becoming very common. So these were things that women were feeling blindsided by, like a lot of things with their health they were blindsided by, but also with their oral health and their dental health at that age.
Oh, big time. I am very excited about this.
So am I.
Some of the things that I have either read or experienced myself have been like, what? What? No. So I'm hoping we get into that. I know we'll get into it today. Yeah. But it's fascinating.
Yeah. And I started to think, like, how can we bridge the gap between, these questions that our patients have and getting them the treatment to help, because, we don't have a long time to talk about things when they come into the office. We actually have to do the procedures and get the thing. So if we can help with this podcast, kind of bridge the gap, the knowledge base with the knowledge there. And most of my team is a women, like we're a women's team. We have one male dentist, Dr. Grant, and he's awesome and he loves being with us. But we are 13 of us are women in the office, and we're all 8 different ages. So some of us are some of my team members are going through perimenopause as well. So they were interested in learning more about their dental health, and they're professionals in that field. So I'm like, okay, there definitely is a knowledge gap here.
Yeah. Amazing.
Yeah. Okay. Well, let's just go into it about like the perimenopause and the menopause. But how do hormonal shifts during perimenopause and menopause, how does it affect your teeth? Because it wouldn't, and it never ever came up to me until a client of mine had told me, she's 46, and it was a couple of months ago, and she goes, my goddamn tooth is loose. And I was like, oh, really? And she goes, yeah, apparently it's menopause. And I was like, no.
Yeah.
No.
That was one of the things that I had seen online too. Like, however, whatever the statistic is, this many women in menopause will lose a tooth. Wow. And people were commenting like, what? No, this is insane. So yeah, it's anyway, go tell us about that, Talia.
Well, our hormones do affect everything, and the biggest thing that women have to deal with during that time is the drop in estrogen, and that can affect our bone health. So you know how they say, like, when you want to lose fat, you can't just work out your arm if you want to lose fat on your arm, because it affects the fat in all your body. That's like your bone density as well. We have, most people, when they think of getting older, they think I'm going to break a hip or something like that. But the bone in your jaw is also affected. So osteoporosis can affect the bone density. And then, you can have teeth that shift, you can have teeth that get loose, but there's also something that's affecting the bacteria as well. And dry mouth is a really big issue for women of that age. And dry mouth, the bacteria that cause gum disease and cavities, they love a drier environment. So we have to fight against that. So we're always fighting against the bacteria. And then they also have the bone density. There's a lot of different factors obviously at play there. But that's one thing that I want to clear up, that misconception is that you're going to lose a tooth.
Yeah.
I mean, we have to address it because it's preventable.
Right. Exactly.
Yeah.
And
it's not just a blanket statement like every woman in menopause is, well, at whatever the percentage is going to lose a tooth. It doesn't have to be if we take certain precautions.
And it's kind of working backwards through all of the layers, where it's looking at your estrogen levels, and it's probably also working with other doctors or encouraging them to go to other doctors as well, or learn a little bit more about everything that's going on, because there's a trickle down effect, and one of those trickle down lanes is your teeth.
Exactly.
Yeah, okay.
I would say that as a general dentist, we do like to view ourselves as the quarterback for treatment, because we are helping our patients. Okay, you have to go to the specialist, you have to go talk to your doctor about this. We're supposed to look at everything and kind of come up with a treatment plan. And you do have to work with other professionals. So some patients will come in and, autoimmune can get diagnosed as menopause symptoms as well. So we have to work sometimes with a rheumatologist or an endocrinologist or a medical doctor, and then your dentist is there as well, kind of quarterbacking these findings or these diagnoses, because we see things that the medical doctor doesn't see.
Right.
Yeah. So, and we're supposed to see you twice a year at least. So we're, even the act of like taking blood pressure, we send so many patients of ours to their doctor because they haven't had their blood pressure checked in like 3 years, and then they come in to get their teeth cleaned, and we're like, okay, so we can't do that today because your blood pressure is 190 over 150, and they're like, what? Oh my gosh! So, we're seeing things that your body is telling you, but sometimes when you're in for your physical, it doesn't get. There's just so many things to go over that the doctor might not be able to address that at that time, or not see it, or your mouth. It doesn't get brought up sometimes in your in your general practice exam, but it is connected to everything. And I think that's something that people forget.
I would never have thought like that it was as closely linked as you're actually saying.
Yeah.
Yeah. I didn't actually realize that you guys check blood pressure, but I guess that makes sense if you have to go and do some kind of surgery on a person's mouth. You kind of need to know where they're sitting.
Exactly.
So receding gums, which is also probably has a little bit to do with the saliva and everything and like the dry mouth. Is the receding gums also part of the dry mouth, or?
The dry mouth doesn't exactly cause receding gums, but receding gums is kind of multifactorial. So there's a few things that can cause it. There's two different types of biotypes of gums. So us sitting here, we might not have the same biotype. There's thin biotype or thick biotype. And if you're a woman that has thin biotype, you are more prone to recession. So then if you add in the lower bone density, and then you also add in maybe that the tooth is positioned in a way that it's more prone to recession, so there's less bone there. And then if you lose bone during menopause, the gum is going to follow the bone. And then also increased sensitivity. Once you get recession, you have a little bit of root that's exposed. And then we do get a lot of women saying, I didn't have this before, but there's been an increase in recession. Also, if you're using a hard toothbrush or medium toothbrush and you have the thin biotype and you're also going through menopause, those are things that are going to cause more recession. That's why we do have to address that quickly, because we want to make sure that that's not getting worse and we're maintaining the periodontal health of that tooth. The gum is so important. The gum and the bone is like the foundation of that tooth. It's where the tooth lives. So we have to address that first before anything else like whitening or cosmetic treatments.
Okay.
Yeah.
And sorry, that's also from like alcohol, black coffee. Like, is that also, or more acidic coffee, I guess I should say, kombucha, using apple cider vinegar? Like, do you see a lot more of the recession during that time too?
What we do see with that, with acidic foods and an acidic diet, is if you already have recession, then you add the acid to the tooth structure and then you're brushing your teeth, then you're going to actually wear away that enamel.
Okay.
So the acid will affect the hard tooth structure. So the root of the tooth, and then also the enamel that's on the actual crown of the tooth. The gums aren't really affected too much by the acid diet, but if you already have that recession, you're going to notice some notches along the tooth structure, which can get very sensitive. We've seen there's different grades of how deep those notches can go. Once you've broken off that initial layer, the wear can go much faster.
Okay.
Yeah. So part of the treatment is deciding whether we just bring the gums up with like a gingival graft, which is a little mini gum surgery. But once you've lost that recession, it will not go back on its own. So you have to kind of help it out a little bit. Or is it a mild recession and we're just mostly going to be protecting the tooth structure that's exposed? So that's always a discussion with the patient. Every patient's individual, and you have to weigh the risks and benefits and where that person's at that time.
So my question is, when I go to the dentist, I go for my twice a year kind of checkups. When they're calling out the numbers or putting the numbers, is that what they're looking at? Is like the gums receding?
So the gums receding, that's a separate numbers that should be called out as well at the end. But when you're hearing those 1, 2, 3, 4, we call that periodontal screening.
Okay.
And I want to just emphasize that anybody that's going to the dentist, whether you're in menopause or not, but especially if you're in menopause, you should really make sure your dentist is doing periodontal screening at least once a year for adults. It tells us at that time basically how much inflammation is present in the gum tissue.
Okay.
So we use those numbers to find out what your actual diagnosis is for your gum health.
Oh.
Whether you're a healthy periodontium or your gingivitis.
Okay.
Or your mild periodontitis, which we call stage 1 now, or moderate or severe. And and it can tell us whether it's generalized or if it's localized in certain areas affecting just one tooth, for example. And that helps us plan what actual type of cleaning you need.
Okay.
Because a person that comes in and they have no bleeding with their gums, so when we're checking with those little numbers, you're just putting light pressure. But if you have gingivitis, even a light pressure will cause lots of bleeding. And bleeding is inflammation.
Mm-hmm.
But gingivitis is the first start of gum disease. Adult gum disease, once gingivitis is present for a long time, it can cause bone loss. That bacteria will actually take away that bone, and that's when you get periodontitis, and that's when you can lose a tooth or your teeth get loose. So we're finding out with those numbers where exactly is that person at in terms of every tooth in their mouth.
So I went, I want to say, to my dentist maybe a year ago, and everything was what it was. I mean, fine, whatever, numbers, nothing changed. And then I went 6 months later, and all the numbers had changed for the worse. Not all.
Oh, okay.
I mean, I don't know if it was all, but it was a significant number had changed for the worse. I think they get higher is worse.
Yes.
Yeah. So a lot of them had gotten higher. And she was like, what's going on? Like, have you been flossing? Have you been brushing teeth? I'm like, same as I usually do. Like, nothing's changed on my end. I mean, I've never been the most consistent flosser. Sure. But my point, I guess, was that nothing had changed as far as I knew, but the numbers had changed significantly just in those 6 months. And then she was like, okay, well, floss more and, get up a notch. And we'll see kind of how you get on. I was like then now much more diligent. And 6 months later, I went back and she's like, wow, they've all gone back to what they were before. Like, you're doing something right. And I was like, okay, I'll keep doing it.
Wow.
But yeah, I guess that's what we were just talking about.
Yeah. And that's why the periodontal screening is so important to do over time, because, you can be one way, like you said, 6 months ago, and then your hormones change, or we see a lot of new moms, they have their baby and they aren't able to floss.
Yep.
They have bacteria that's similar to menopause because we have the hormone changes.
Yeah.
That just causes inflammation, and you sometimes need a little extra help. So if we see those numbers change a lot, we have to see our patient more often for that next few visits.
Kind of catch up.
Yeah, catch up, get them back on track, get those numbers, get the bleeding to go away.
Right.
And then we know that person is kind of disease controlled, because this is a disease we're always going to be fighting our whole life. It's a fight against that bacteria.
Right.
So we can have, people that have gum disease, we can get them back to where they don't have gum disease. However, they'll still have bone loss. But if you do those numbers, they don't have any bleeding. So we know that the treatment is working. They're coming in every 3 months to fight against that bacteria. We call that the biofilm. It sounds like it's like a superhero thing. We're fighting the biofilm. But every 83 days, that will build back up. And so people that have had history of gum disease, we know that, basically for the rest of their life, we want to see them a few times, at least 3 times a year, to make sure that those numbers are staying where they should be. But there are some practitioners that, they don't do the screening. So they're doing the cleanings, but they're not sure exactly what's going on with each tooth in the mouth. So that's why if you do go in for your visit, make sure you ask for periodontal screening, and they do check the recession at that time as well. So they'll do the numbers and then they'll do the recession. They should check mobilities of your teeth, and then you can have that over time to see how you're changing.
Because I wouldn't have known otherwise. I would have just kind of done my regular routine that I always did that always seemed to be fine.
Yeah, exactly. And those numbers are important as well, because you can take x-rays, but it takes a long time sometimes to see that bone loss on the x-ray. So you need to have 30% of the bone destroyed before you can see it on an x-ray. So that's kind of shows us that there has been attachment loss or loss of bone, but we want to see the real-time numbers. Right. So we have to take the time and do it with our screening.
Okay. Oh. So then bone loss, a big part of that is going to be through estrogen dropping for a female. There's obviously other reasons for bone loss, but if we just look at estrogen dropping results in bone loss, which is osteoporosis, and then the teeth start to become affected. Okay. Just wanted to make sure. I just wanted to get it clear with all of the different levels.
I would say the estrogen drop affects more of the bone density.
Okay.
So you might not get a drop in bone, but the bone will be less strong.
Okay.
But then the drop in bone comes from that bacteria. If you're not able to remove it properly, or you have other factors that are causing you to have gum disease, like smoking, for example. Smoking is something that can increase your chance of gum disease by a huge amount, because it just promotes that certain bacteria that cause gum disease. There's just, these bacteria have been studied, and we see increase in menopause and smoking and other factors. So it's going to affect the density, but if you allow those bacteria to thrive, then it will cause loss of the bone height as well.
Okay. Got it. Okay. Then also going towards dry mouth again, which is one of the interesting things. We had talked about that on one of our other podcasts that we had done, where it's not just the dry mouth, but it can be the dry eyes, it can be the dry skin, everything's kind of happening. I have also noticed that women sometimes will develop a cough, like more of that drier cough, just because their mouth is dry. But what are some causes of the dry mouth? Obviously, it's going to be, I'm assuming, a lower estrogen. But also, what are some things that women can do to help with that dry mouth as well?
So yeah, sometimes we have to find out if they're having dry eyes and dry skin and dry mouth. That is kind of a ding, 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 bell is whistling in my head. I'm like, okay, this person might actually have an autoimmune disease like Sjogren's syndrome, which I think is very underdiagnosed. It does affect 9 out of 10 people diagnosed with it are women in their late 40s.
Oh, okay.
And it's actually your immune system is destroying the glands or fighting the glands that saliva glands. So they're exocrine glands, so things that produce fluid in our body. So our tear ducts, our tear glands, our lacrimal glands, and then our saliva glands. And it can also affect other parts of our body, like our skin. And it's an autoimmune disease, which we know women are affected by much, much more. And that's when we were talking about the multifactorial disciplines. So rheumatologists, there's a blood test you can do to actually get diagnosed with it. There's factors in your blood that show that this autoimmune disease is present. So a lot of women live with this syndrome and they don't even know. And it's like, okay, I'm going through menopause. I have to take my eye drops, and I have to go to see my dentist more regularly, but there's actually a syndrome that they have. Dry mouth, if it is just menopause, it can be affected as well, but it wouldn't be as bad as, maybe everything being affected. You can use saliva substitutes. So, something called biotin. It's something you can buy at the store, and there's different ways you can take it, like a spray or a lozenge that you can take, a xylitol lozenge, which also promotes fighting against cavities. So you always want to make sure it's sugar-free. Yeah, of course. And just the main thing I think is staying hydrated, using electrolytes appropriately and staying hydrated throughout the day. But if you actually have an autoimmune disease causing that, then you might have to look at getting a prescription drug, which helps stimulate the glands to produce more fluid. So it will be something that's prescribed by your doctor that will help actually with that, in terms of, it's a chronic autoimmune disease. It's a chronic thing that women will have to deal with their whole life. There's no cure for it.
Okay.
But it is underdiagnosed. So I want to make sure that people are aware of it.
And what's it called again?
Sjogren's syndrome. So it's SJOGRENS.
Okay. And the symptoms are
dry everything.
Dry everything. Really?
Dry eyes, dry mouth.
Okay.
Dry skin. Yeah. And fatigue. Fatigue is a big thing that's affected with it. People mention with that, because it is, I think anything autoimmune is going to affect it. You do get muscle aches, you get fatigue, you get brain fog, and then you get those symptoms.
Oh, okay. Okay. Yeah. So I think one of the things, kind of just with what we're talking about and what we would encourage people to do is just be very vocal, as much as your mouth's going to be open while you're in the chair talking to someone, but just be very vocal about everything, like not just specifically your teeth or your mouth, but even just explain just a little bit more about what you're going through.
Yeah.
You would encourage people to do that.
Yeah. Be vocal. It's your health. We always want to hear about, it's always easier for us to find out what's going on if you actually tell us, versus trying to guess with just the numbers or the radiographs, because we don't know what you're experiencing until you tell us. And be an advocate for your own dental health,
I think we may have talked about this as well. I think so. But about the bad breath. Like women's breath changes when they're going through menopause. Yeah,
it's just mostly from those bad bacteria types liking the drier environment.
Okay.
And we call bad breath halitosis, and that that's just mostly fighting against those bacteria, like I said. So we have to try to stay hydrated, see your dentist regularly. So going in for the cleanings that you actually need versus, I just need one once a year. No, sometimes you have to see us more often because that biofilm does build up, and we're going to help you fight against that bacteria. I think tongue scraping, I know we were going to talk about that. Like, tongue scraping is a really great tool for bad breath.
Okay.
I do like a baking soda rinse. So baking soda used on its own with your toothbrush is too abrasive for your teeth. But if you put baking soda in a rinse with like a warm water, and just do that for about 30 seconds at night and in the morning, that's a great tool to fight against that bacteria as well. And it's very not very expensive. Everyone can get that at the grocery store. And just mostly keeping everything as hydrated as we can.
Well, and I guess what you would end up seeing too is that if a woman is experiencing bad breath, she may not necessarily know other ways to combat it. She's just going to be brushing her teeth more, which is therefore going to wear down the enamel. And
we see that a lot.
Yeah.
I think we always see patients that have their coffee or something in the morning, and then they're brushing their teeth right after and then going to work.
Driving the coffee into the acidity into the teeth. Yeah.
Try to wait at least. Yeah. That's where that baking soda rinse could come in. You could use the baking soda rinse because that helps bring everything back to the neutral pH.
Yeah, okay. Yeah.
But if you can, just rinse with water, which helps get rid of the staining as well, and then wait at least 60 minutes before you brush, at least. Okay. So that you give your saliva time to work. And especially if you have lower saliva production, you might even need more time than that. And that's where we see people that have higher cavity risks because they're having, they're wearing down the enamel with the acid. Or if you're really a frequent snacker, we see that as well as your cavity risk will increase because you're not allowing that saliva in between your snacks to bring that pH back down.
Right.
So, having like 3 main meals and then letting a couple hours in between where you just drink water or something that's not very acidic, then you're gonna give your teeth a higher risk of not getting cavities. Like, it's gonna be better for your teeth.
All these little things.
Yeah.
Wouldn't have known.
I know.
Wouldn't have known. So then what about your gut microbiome and how that affects teeth and breath and gums and enamel?
Well, the main thing with gum disease, like we said, it has those bacteria, and those bacteria don't just stay in your mouth where everything's connected, like we already talked about. So the main thing with that disease, periodontal disease, is bacterial translocation and low-grade systemic inflammation. So people that have gum disease will experience more gut issues. And there's actually an article that just came out this morning, and I am a nerd. I do like to get the journal emails. Like, my friend is a dentist and she'll send them out and she'll like, look at this article. And it's basically saying that periodontal disease is connected to colon cancer. And I can send you the article and you can read it. And there's so
well,
many.
we can put it in the show notes too.
Yeah.
Just for anybody interested in reading it.
Yeah. Well, we
Really?
already know it's connected to so many things. Like your risk of dementia goes up when you have periodontitis. For older patients, for women that are pregnant, they have a higher chance of having a low weight baby at term if they have gum disease. For people that have diabetes, they have a harder time keeping their sugars stable when they have gum disease. And now we're seeing a link with something like colon cancer. So we just know that if anytime we can lower inflammation in our body and not have a low grade systemic inflammation, it's a good thing for yourself to do that. So yeah, we're just seeing more and more the research coming out that we are connected to the other parts of the body.
I mean, it makes sense. It's our mouth, and our mouth is going into our gut. Like, it makes sense, but I don't think I would have thought about it.
Yeah, I know.
So then what about indigestion, like acid reflux? It's basically like a big acid bomb in the gut going straight up, right?
Yes.
Yeah.
Yeah, one thing with that is that a lot of people don't get symptoms, and then they come in and it's been a few years since we've seen them, and we're like, whoa, there's been a lot of changes on the enamel. We can see that because there's a certain pattern of wear that you see on a tooth when it's been affected by acid. There's these smooth cuppings on the top of it, and it's different than what a tooth looks like when it's just been grinding.
Okay.
So we'll ask the patient, do you have acidic diet, and then, we're finding out probably at night that when they're lying down at night sleeping, that the acid's coming up. And so then we'll send them to usually their medical doctor or an ENT, and the ENT can actually put the scope down and sometimes see the acid there.
Yeah.
And then we have to deal with that and figure out, how they can treat that, because, over time it is shown that GERD, which is gastric reflux, can affect the cells in your esophagus and cause cancer. So you have to treat it, because it's not just your teeth, but it's causing changes like that as well.
Now, for people who are listening, what would you say? So, you were saying you ask people if they have an acidic diet. What actually is that? So what would be some foods that would be considered contributing to an acidic diet?
Okay. Well, I'll give you like the most extreme one, which is we do see the apple cider vinegar trend. I don't know if you've seen that show on Netflix.
I saw it. It's very disturbing.
I know. But you do get people that do get onto these like health kicks where they have to take, they have to drink apple cider vinegar all day in their water. And it's different than if you can take it, you can take like a little cup of it and then you drink it in one go, and then you rinse with water and you wait to brush. Yeah. That's not going to have the damaging effect as sipping on lemon water or apple cider vinegar all day long. Yeah. You know what I mean? Or sipping on your coffee all morning long. Yeah. So that would be an example of something like that. Okay. But then in terms of foods, the foods, most people, it's mostly like lemons. That we see a lot of people that have the habit of like chewing on lemons or sucking on lemons, and you'll actually see a certain wear pattern on their front teeth.
I was guilty of doing that, where I went through a bit of the phase where actually I had started drinking kombucha.
Oh yeah.
Every single day I drank kombucha. Oh, wow. And I did a photo shoot. It was quite a few years ago, and I did a photo shoot, and they tend to put a fan in front of you so that your hair can, wave in the wind and stuff like that. And I smile. Yeah. And so I smiled, and the wind from the fan caught my tooth.
Oh, and it hurt.
Oh, it was so painful. And it was because of like the excessive drinking of kombucha. I probably whitened my teeth right before that as well. And then also like the sipping of the apple cider vinegar all morning kind of thing. You're thinking that you're being really smart, and instead of just doing the one little shot back one time, it's even better if you just mix it in with like your big jug of water and you just sip it. And it is not. No. And I paid the price for it, and never again. So
see, that's really good that you were able to recognize that and fix it pretty quickly.
Yeah.
But yeah, if you're fighting against dry mouth and things like that, then that's just going to have a worse effect, because you can't fight it back with your saliva. So yeah. And then a lot of people do drink soda here as well, like soda or margaritas on the beach. we do have a few patients that are like, I never had a cavity before I moved to Cayman. And I'm like, how many margaritas do you have a week? Like happy hour and things like that. And like their lifestyle has just changed a lot once they move here, especially the first year that they moved here. They're very social. And then I do find that we have to kind of help them figure out ways to get back to health, get their risk down.
Yeah. Let's move on to grinding, jaw pain, and sleep issues.
Okay.
Women in perimenopause often report teeth grinding, jaw tension. Is this stress related, hormonal, both?
Well, the research is coming out more and more that it is related to sleep and the oxygen levels at night. So we have something, most people think, oh, I don't have sleep apnea. Like sleep apnea is an extreme part of that, but we do have something called upper airway resistance syndrome, and I have it, so I can talk about that. It's where, you're at night and your jaw is so relaxed that the jaw just falls backwards and your tongue is falling backwards into your airway, and then you're not getting enough oxygen, and then it's showing that your nervous system is saying to your brain at night when you're unconscious, I need more oxygen. So it actually starts to grind your teeth so that your airway is opening up. Your jaw comes forward and your airway opens up. We see that a lot. We see most people that grind their teeth have that. So you have to figure out a way for them to get more oxygen at night, which might involve, some treatment. One of the easiest ways is to get something like a mandibular advancement device. It's kind of like a night guard, but it goes on the top and the bottom teeth, and it just stabilizes your jaw in a certain position, or it even moves it forward a little bit. And then you know that your airway's staying open at night.
How do you know if you have it?
Well, you can do a sleep study.
Okay.
I did one at home through with Dr. Yamin at Doctor's Hospital, the ear, nose, and throat doctor.
Yep.
And she sends you home with a little device, and then you wear it at night, and then you can see how much oxygen you're getting all night.
But was it because your sleep was bad or something? Or did you just go to her because...
No, my husband was like, you grind your teeth. And I was like, what? No, I don't. I'm a dentist. I can't grind my teeth.
Right?
And then, a lot of people will say, oh, my partner says I snore, or there is a sleep questionnaire that I will give patients that tell me things like that. So if I do ask about sleep at a new patient exam. Tell me about your sleep. Do you sleep 8 hours through the night? Do you wake up a lot at night? Does your partner say you snore? Do you grind your teeth? Do you ever wake up with headaches? Do you ever wake up with a sore jaw? And that can kind of start the conversation. There are a few patients that don't have that and they just grind their teeth. And that is kind of like a muscular nervous system thing going on. But that's more rare, I find, than someone who has something going on at night with sleep.
Okay.
But the stress was kind of an old thought that we used to have. Oh, you're just stressed. You're just stressed at work. But now we're finding actually it's something else.
Right.
So
don't sleep on it.
Yeah, exactly.
Like it's
get the sleep study.
Like it's actually something that you should be concerned about, or you should look more into.
Of course.
To see. Yeah.
Because people that have sleep apnea, upper airway resistance syndrome is like a mild sleep apnea. It's they don't actually say you're not getting those where you pause from breathing, but you're getting lower oxygen, which still affects the brain.
Yeah.
But for example, during pregnancy, my upper airway resistance syndrome turned into sleep apnea. So then that can affect women as well. So if during pregnancy, or if you gain some weight or something like that, or things change in your life, you can develop from that into sleep apnea. And that has a huge effect on your overall lifespan and just your quality of life. Like when I started using the advancement device, I was like, oh, this is how you're supposed to feel when you wake up. Like you don't feel so tired, and some people get the septoplasty, which also helps, but sometimes it's still the jaw is falling back. So even if you get the septoplasty, it's not helping as much as you think. Yeah. One other thing I'm going to say about that is a lot of people are like, okay, just get the night guard. But before we give you a night guard, you need to be screened for those sleep issues. If we just slap a night guard in there and we just want to protect the teeth, sometimes we're making that issue worse because the tongue doesn't have enough room. anymore, and it's still causing the jaw to come back. So you're going to protect the teeth from getting worn down, but you're not actually addressing why the grinding is happening.
Right. Yeah.
This airway dentistry thing is really coming in, the more and more research is coming out, and it's really becoming a big thing now.
Mm-hmm.
But there's still so much to learn about it and how we can help patients, and especially living here because we don't have access to like the major players in the States that are starting to get into this treatment. Like there's certain orthodontists that are doing adult palatal expansion, and they're doing jaw surgery, and they're doing things like that to help people sleep better and live longer. But we don't have access to that here. So we're trying to figure out, okay, we've made a few patients a mandibular advancement device, but long term, what are they looking at? Are they going to use this for their whole life? Are they going to use a CPAP, or are they going to go to the States and get something done like surgery? But we can help you as the quarterback.
Yeah,
figure that out.
Right. I'm going to move on to cosmetic and aesthetic concerns. So many women start noticing their teeth shifting, spacing, or becoming more brittle as they age. I've literally noticed this week.
Oh,
I was, I think, either recording something and watching it back on my phone, or I was talking to somebody while I was looking in the mirror. I can't remember. Probably both. And I was like, my bottom teeth have always kind of not been straight, but not straight. And then I was like, what? Why do they look more crooked? And then, that's probably just in my head. So anyway, Talia, what's going on here? Is this in my head? Is this potentially something else going on?
No, it's definitely something going on. As we get older, our teeth always want to move. Just like everything in our body, it's not going to be the same forever. So our teeth always want to move towards the center. So there is something that happens as time goes on. That's why if you do orthodontic treatment, say you had orthodontics as a teenager or as an adult, the dentist says to you, you need to wear this retainer for your whole entire life.
Yes.
Do they? I've never had anything.
I did, and I just stopped.
Yeah.
And it goes back.
Yeah, it does.
Yeah.
I mean, it might not go back to
it.
where it was, but it will shift.
Yes.
Well, right, because I never have. I never
Right.
needed braces. I never needed anything.
Yeah.
And now I'm noticing these changes.
Yeah. So that's just something like that will happen. All the tissues in our face will move, all the bones in our face will move, and the teeth will move as well.
Right.
But if you want to change that, you can do something that's conservative, like traditional braces or Invisalign, and that's just orthodontic treatment. It takes about a year to straighten your teeth, and then you have your retainers, and you just prevent those shiftings from happening because you have to keep up with it.
Right.
The aesthetic concerns are something that are real as well, because we do wear down our enamel every year. Every year that we live, our enamel gets worn down from eating, from, just using a fork every day, things like that. Your enamel naturally will go away, and we only have a certain amount of it when we're born. When those teeth develop, we only have a certain layer of enamel, and that doesn't get remade. However, the middle layer of our tooth called dentin, that's something that gets laid down every year. We have cells that make new dentin every year. The problem is the dentin is yellow and the enamel is white. So every year your teeth actually get more yellow naturally.
Right. Not because of all the coffee we've been drinking.
That too.
It doesn't, right.
Yeah. But as we age, our teeth will just become more yellow in appearance because we have a very thick layer of dentin. Versus when we were a teenager and that tooth was just coming out, it had a thinner layer of dentin and a thicker layer of enamel.
So they're like swapping.
Mm-hmm.
And then all of a sudden people are starting to notice that they have whiter teeth yellower teeth, and then they start to whiten them.
Yes.
And then they rip past the enamel and
Yeah.
okay.
Whitening isn't too bad for your enamel if you don't do it every day. Like so we get some patients that are like really obsessed with keeping, the shade a certain shade, and so they're really doing it a lot. But if you do it the proper way and then you take a break and you just maintain that whitening a few times a year or once a year, then it's not bad for the enamel.
Okay.
Yeah.
Well, that's good
Even
to
as
know.
we age, that's still okay?
Yeah, that's okay.
Okay. Anything else we can do to keep our youthful smile?
Well,
Invisalign, whitening,
Invisalign,
just not too much.
Invisalign, whitening, where the teeth that are worn down, like if someone has been a grinder or they they've worn down the teeth from acid wear or things like that, the teeth can look very porous or translucent, which can be a concern. Or just that the shape of the tooth will change because of the enamel's been worn down. So you can see, some people will have all of the teeth in the front will be the same length versus a youthful smile will have your canines are a little bit more pointy, your laterals are slightly shorter than your central teeth. There's kind of a shape to the smile. But when we see wear, it's all one length. That can make you look older. So, restoring the proper lengths of the and shapes of the teeth, that's usually done with cosmetic tooth bonding, like just with filling material, which is more short term, but it looks very nice. But you have to maintain that a little bit more often, or you could do something more long term for that, which is like a veneer, which is made out of porcelain, and that can last up to 20 to 30 years if it's done well.
Oh, I didn't realize it lasts that long.
Yeah, me either.
Yeah. The new materials, that have come out in the last 10 years in dentistry are very good, and they're bonded to the teeth versus just slapped on with cement. Okay. When you have that bonding on with the certain material, they last a lot longer. And then protecting them from being worn down again. So using a retainer at night or a sleep device or a night guard will help.
Yeah.
What can women do proactively in their 40s and 50s to maintain strong teeth and gums?
The main thing I would say is to visit your dentist regularly and ask for the periodontal screening, because you have to have a treatment plan that's tailored to you. So everybody is different. That's why I say at our office we do individualized dental care, because we're not going to do the same thing for everybody. We have to do that screening first. But yeah, I would say just making sure that you're keeping up with it. Like everyone's like so up with, getting their hair cut and getting their molds checked and everything, but just have the dentist on that list too. It's usually an hour and a half.
Even if my teeth don't hurt, my teeth feel fine, still go to your checkups.
Yeah, and because when we look at, issues that people have, everything gets more expensive when you have those emergency treatments. Yeah. And being regular with your care over the long term is going to save you actually money as well, and help with preventing pain, preventing problems where you have a loose tooth. Once you start looking at replacing teeth, it gets, you have to have little surgeries and everything. So you want to try to prevent that. Yeah. Your natural teeth are the best way to keep everything safe.
Yeah, for sure.
And healthy.
Are there any specific nutrients, vitamins, or minerals that we could focus on for better oral health?
Yes, you can. Vitamin D is a big thing. So gum disease, I keep going back to gum disease, but it affects 40% of the population. So when they do blood tests on people that have severe gum disease or even moderate or mild, but with the severe gum disease, it's very deficient in vitamin D, most of those patients. So just supplementing with vitamin D, vitamin K, magnesium is actually very important for bone health, and then calcium. So calcium and magnesium should be taken together so you can absorb it properly. And then I just take a multivitamin, but I take extra magnesium and extra vitamin D. And then once a year, I do get my blood levels checked for all of those vitamins just to make sure, we're in the right range. But yeah, vitamin K, D, magnesium. I take collagen as well. I mean, collagen can help with your bone health and all the tissues around the teeth as well.
Yeah.
Oh, okay.
As far as menopausal women or women in perimenopause, should they come to the dentist more regularly, or is it about the same? And are there certain screenings they should be asking for?
Just the main thing is that periodontal screening, which we've talked about a lot today. But the other thing that we're going to be starting to do at our office, which I'm really excited about, is saliva testing. So you're able to come in and we're going to do the saliva test to see which kind of range of risk you are in for cavities and gum disease. And then if you are showing any of those bacteria that are in the red complex, which is bad, it's more often usually once you're in that age group, if you're very, very good at home, your home care is excellent, you have really low risk, you aren't really having too much dry mouth, any other symptoms, then you can be okay coming in twice a year. But if those screenings are showing us, even for, a few years, we might have to see you more regularly, just do it because, you know, you're going to get back on track. And once we have a lot of inflammation, it is harder to treat that. We have to go back into the protocol of treating you like the disease is present. So you have to end up coming in more often. Sometimes you need to have numbing for those cleanings. So if you're able to stay on top of it and do the treatment that's recommended, then, sometimes it is 3 or 4 times a year. But like I said, it's 1 hour each time you come. Yeah.
All right, let's do some fun and relatable things.
Awesome.
Is there a dental myth you hear that you'd like to debunk?
Well, one thing is your friend, like, oh, my tooth is loose. Like most people think it is normal to lose a tooth during pregnancy or menopause, and it's not normal. That's one of the myths. Like you don't have to lose a tooth because I see a lot of my patients as well. Like, oh, I have 4 kids, and that means I'm going to lose 4 teeth because of the 4 kids, like the 4 pregnancies. And it's like, no, we can do it. We have ways to prevent that and treat that. Right.
What's your go-to daily dental routine? Do you have products that you swear by?
Yeah, I mean, I have a pretty simple routine. I do floss every day. And
I should.
I do floss every night before I go to bed. I floss before I brush. I brush for 2 minutes.
Oh, does that matter?
Yes.
Okay. Yeah.
You want to floss, and then you get all the gunk out, and then you brush it away.
Yeah. Well, I mean, it makes sense.
I'm a little bit OCD. Sometimes I'll floss twice just to make sure I get a fresh piece of floss. I do brush with an electric Oral-B toothbrush. I do like the Sonicare ones too. I don't have a preference for those, but I do make sure that the head is soft of the toothbrush because I do have thin biotype. I've had a gum graft already. I do have a gum recession that's starting in certain areas, so I'm using a soft toothbrush. And I use a toothpaste called Risewell, and it doesn't have fluoride in it because I do have a very low risk for cavities. But if you do have higher risk for cavities, sometimes we have you do a fluoride toothpaste at night, and then you can use the Risewell toothpaste in the morning. But it has mostly calcium and phosphate and something called nanohydroxyapatite in it, which is
we're using it.
Okay. Yeah, and it remineralizes the teeth the same way that fluoride does.
Okay. And this is available at where I buy toothpaste?
Yes. Oh no, sorry,
No,
it's in our office.
In your office.
Okay.
Yeah.
But I think there is a couple products. I think Island Naturals might have had a product with it with nanohydroxyapatite. I'll have to check that.
Okay.
It is more of a newer product, but it's something that if someone's more conscious about not wanting fluoride, then this is an alternative product.
Yeah.
I thought fluoride was a good thing.
There's just more research. It is controversial right now. I mean, there's definitely a time and a place for it. Like, for example, we do apply it to teeth in our office like a varnish. A varnish, we know that that's not going to be going too systemic. And if sometimes some people do need the extra help with fluoride, if they do have a lot of acid wear or they have a lot of cavities, there is a time and a place for it. But, for example, a lot of places are taking it out of the water. They're finding that it doesn't help really to have it systemically.
Oh, okay.
Right. Yeah,
it's
more
that's
localized.
What I remember, like growing up in Canada, it was in the water.
Yeah. And then with the toothpaste, it's much better to use a varnish because with the toothpaste, you're brushing for a minute and then a lot of people rinse with water after, and it's not really sticking on the teeth that much.
Okay.
Yeah. One other thing with my routine, I always tongue scrape as well.
Oh, right.
Right.
Tongue scraping.
I haven't gotten into that.
Oh.
My kid does.
Oh, that's
Does
good.
he?
Yeah. I haven't though.
I've never tried it. I've seen it, but that is, so we're moving on now to our hot flash or hot take segment, which
is it in there?
Yeah, and it's in there. So
Then we can
hot
learn
flash is not good. We don't want hot flashes.
Okay.
But hot take is good. So we're going to ask you a few things in oral care or dental care, and we want to know your opinion.
Okay.
So yes, tongue scraping. Hot flash or hot take?
Hot take.
Hot take.
It's so important, especially for people that do experience bad breath. There's a large amount of bacteria that's on your tongue. You'll be surprised what comes off of that.
And it looks like it's an arc kind of shape, and you put it in the back of your tongue and pull it forward. That's it?
Yeah. Don't do it too hard.
Okay.
Yeah, I just do a couple swipes, and you can buy other ones as well that are plastic, but I do prefer like the metal ones with the handle.
Okay.
And then you can clean it after, and it's very it's very hygienic because the metal is very clean, and you just rinse it with water. And usually I'll do that before I brush. So I'll floss and I'll tongue scrape and then I'll brush.
Okay.
In the mornings, it is shown to help with lymphatic drainage. So you're
doing the tongue scraping.
Yeah.
Oh.
And just it helps get your body like, okay, yep, it's morning time. I'm awake. Let's get our lymph system working. So I do it morning and night.
All right.
Yeah.
This is fascinating. Okay. Oil pulling.
So that would be a hot take, but only if you're not replacing it with something else. So some people are like, oh, I don't need to floss because I oil pull.
Okay.
And you know what? If you want to oil pull, there's nothing wrong with it. It just takes some time. Like it takes about 4 minutes of your day or something. I used to do it I wanted to try it and I didn't see like too much of a change, but some people I think that have the dry mouth, they do say it does help them.
Okay.
But just not replacing the flossing or brushing with that.
Okay. Yeah, fair. Charcoal and natural toothpaste.
Charcoal is a hot flash. We do not want to use that.
Ah, okay.
It's extremely abrasive on your teeth.
Interesting. And then like I think it's out there as a whitening agent. Is that right? Yeah.
Usually you want to avoid anything that says whitening toothpaste because it's just abrasive and it's not going to be on the teeth long enough to actually whiten them.
Yeah. Okay.
So a natural toothpaste is a hot take, depends on, what's in it. You definitely need something to remineralize the teeth, like the Risewell toothpaste that has all those factors. Using something that says it's the this is like a green tea toothpaste or something, I would say that's a hot flash.
Yeah. Okay.
You want something in there that's going to help. But I know brushing your teeth is better than not brushing your teeth.
Right.
But try to find like a low abrasive toothpaste, none of those ones with like the little beads or anything like that.
Oh, okay. Yeah.
Something that looks more like a lotion versus like a
gritty.
Yeah.
Yeah.
Okay. Oh, good to know.
Mouth taping for sleep.
It depends actually, whether it's a hot flash or a hot take. It can be really great for some people. However, if you can't breathe through your nose because you have something like a deviated septum or something, the mouth tape is going to be difficult for you to use. But you do have to do that screening, the sleep screening, before you try it.
Right.
So it's good for some people, not great for everybody else, but it does help for people that need a little bit of help with their lip competence. But you should also use that with myofunctional therapy. So myofunctional therapy is basically like physio for your mouth. And if you ever are having a tongue tie release or you are looking at getting better oral posture where your tongue is sitting up at the top of your palate and your lips are closed and your teeth are slightly apart, that's a person that is an expert in helping you with exercises to strengthen those muscles. Lip tape can be used, but sometimes it's, if you're not strengthening the muscles, it's kind of like a Band-Aid and you have to keep buying it.
Yeah. A literal Band-Aid.
Yeah.
So clear aligners versus traditional braces. So like Invisalign versus braces. Are they both hot take, hot flash?
Depends on the patient.
Okay.
So definitely there's a time for Invisalign. There's a time for braces. The main thing with Invisalign is compliance. So the patient has to use the aligners to actually move the teeth a certain amount of hours per day. Braces, you can't really remove them. They're always working. Once you remove the aligner out of your mouth, the force is off the teeth. And so you always have to maintain with compliance.
Okay.
But some people just really adult patients love Invisalign.
Right.
And we can do a lot with it. We can do a lot with Invisalign that we used to not be able to do.
Oh, amazing. Yeah. Okay. Electric versus manual toothbrushes. You said that you have an electric.
Yeah.
Should we be using electrics? Is that the hot take here?
I always go back to the science. So the studies show that you're going to remove more plaque per oscillation of that toothbrush moving with an electric versus a manual. So, if you are rushed with your routine some nights, you're still going to do a pretty good job with the electric versus the manual. You do need a special technique for it. You don't want to be pressing too hard. You have to use an extra soft toothbrush with a manual, and then you have to make sure you're brushing for 2 full minutes. So you are just you're doing it just faster with the electric.
Yeah. Okay. Teeth whitening strips versus professional whitening.
I always say professional because we're able to, one, screen you for any issues before the whitening goes on. Because, you know, if you have cavities on your front teeth and then you're whitening, it's going to be a lot more sensitive. The whitening strips are pretty high grade. Like they just give you like a lot in one go. It's just a higher percentage of peroxide versus the professional. It might take a little longer, like 2 full weeks to get to where you want to be, but it's just going to be a little bit more gentle and less sensitivity. And then the whitening strips, they do fall off the teeth sometimes, or if there's a lot of crowding, they don't really go on well. And that you can kind of taste the white. I've used them before. You can taste the whitening in there, and it's just nicer with the trays that are custom made for you, that you're just not swallowing any of that peroxide.
Right.
Yeah.
But both of them are somewhat okay.
Oh yeah.
Well,
I mean,
as long as you're not overusing them, I guess.
Yeah, exactly. I mean, if you have an event coming up and you don't have time to go get custom made whitening strips and all that, I mean, trays, then that's fine. You can use the strips. It's not going to do it. As long as you're seeing your dentist regularly and it's not that you have active gum disease and stuff, and then you're just whitening your teeth.
All right. Very good.
Yeah. Well, thank you. It's been a huge wealth of knowledge for both of us.
Yeah, definitely. I'm going to check my calendar and see when my next appointment is.
I know, right?
It feels like it's been a while. I better get on that.
Yeah.
And how can people find you? Last bit.
Well, they can find our office. We're located in Governor's Square, so pretty central location, right across from Governor's Beach. We're underneath the Marsh Clock Tower. We're just right beside the Chamber of Commerce. We are located on Instagram at My Island Dentist Grand Cayman, or you can check out our website, www.myislanddentist.com. Only 3 W's. And we do have online booking available. So I do find that's really convenient for a lot of people here because everyone's so busy. You'll see
and I forget, right? Oh, I got to call, not necessarily the dentist, but whoever. I got to make this appointment. And then it's 6 o'clock or 5 o'clock. I'm like, oh, I forgot to call.
Yeah, exactly.
Gotta do it tomorrow. And it keeps getting kind of put off because anyway, I can go on the website anytime, any of the day.
Oh, yeah. I just find people are booking late at night, like after they put their kids to bed or they're figuring out, okay, what's my week looking like? Oh, yeah, I got to get that visit in. So we did start doing that about a year ago, and we find that just helps people get better access to coming to their appointment. So yeah, that's how you can reach us.
Yay.
That's awesome. Well, thank you. I really appreciate it for coming in and taking the time out of your day.
Thank you for having me. And I hope that it was helpful for some people.
Oh, definitely.
Very much.
Yes.
Very much.
Good.
Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!